Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. Good morning. It's funny.
Good morning.
I'm so glad that you have brought a pain medicine physician here. We call it pain medicine?
Pain management. And we brought Ina too. Our
Ina,
manager.
Of course, we always bring Ina.
Yeah.
Ina. How can
When
we do this
Ina
without
is a
Ina?
pain in the neck, I call Dr. Marrero.
I try my best.
That was so bad.
So,
She's never a pain in the neck.
For those of you that have a person at home that's a pain in the neck or a pain in the lower part of the back, Dr. Marrero.
Rear end.
But let me tell you something. I'm glad you're here
Yes.
because I had read somewhere, and I don't know where. I tried to tell this woman who was a nurse. I was with over there at the Mencia Convalescent Center last night, and there was a nurse who had a lot of problems, and she just had some major surgery in her neck and her back, and she's still in pain. It's been only probably a few months, but I thought that I had read where you can train your brain to deal with pain. That sounds like it's a poem, but is that true? Are there, tell us what you know about that.
Definitely, there's a psychological component. For example, people or patients that are under stress at work, in the house, sometimes they say, you know what, my pain is getting worse. And yeah, there is a factor, a psychological factor that can exacerbate the pain, no doubt.
And also there is a cultural component. You will see certain culture that they are not allowed from a very young age to express the feeling of pain. So, and you see that in a lot of Asian cultures, where you see then other culture, the European, the Italian, where they will manifest the minimum amount of pain, but the expression might be greater than the level of pain that they are experiencing. So there is a cultural component, there is a psychological component to pain. And, Dr. Marrero has been working with us and helping us with the pain management portion of the complexity of care, which, had been a godsend to us, to the office. Because people will do things. And, for example, we have a young guy that he had been my patient for many, many years. And his daughter just moved down to Florida, and she bought 2 or 3 Doberman. Now, the guy, he been my patient, and he walks with a cane. So he decided to take the 3 dog out for a walk. And they pulled him, and he fell down, and he has a compression fracture. So I just sent the patient yesterday. We made the referral to the other office where Dr. Marrero can do procedure. So we can do a procedure called a kyphoplasty. And we're going to talk, one of the shows we're going to talk about is going to be compression fracture in the back. But today we want to talk with Dr. Marrero about something that is even more common that people tend to neglect. And then an acute problem, a sudden problem, can become a chronic problem. And it will deform your back. So we want to talk about sciatica today with Dr. Marrero. Dedicate the half hour to sciatica, why sciatica happen, what happen if we do nothing, and what can be done. And does it require major surgery? So let's talk about.
Okay, that's excellent. Why don't you, though, just explain the difference in acute and chronic? Because people may not know that.
So, for example, if you are walking your dog and your dog tends to pull you in one direction and you twist your back, and at that moment, you feel the pain in your back going down your leg or going to your butt, because some people think sciatica have to go down the leg. It doesn't have to go all the way down. Depends what nerve is being affected. And if you go and you position yourself properly, put some ice to cool down the area, and everything seems to go back to normal and you don't see pain ever again, that was an acute problem. It was a sudden, short-lasting problem. And that area that you pull and damage can become inflamed. And that inflammation, if you keep exacerbating the problem, so you decide to go to work, then you decide to go to the gym as you normally do. You decide to go jogging or go play golf, and you keep doing it, and you keep adding to the injury that you already have. It can become a chronic problem. So something that will last for months or years, now it's a chronic problem. And Dr. Marrero, you can tell us.
Sure.
Okay, your turn.
And just very quick to address your initial point. Also, patients who have depression. Okay, if you don't treat the depression, going back to the psychological component, you don't treat the depression, you cannot make the pain better. So just
that's a very important point. That's a great point, because I usually tell my patient, I was a psychologist before I became an MD, and I usually tell my patient, depression is in the spectrum of feeling pain and feeling sensation of your body. Depression is the opposite spectrum of sedation. So when we put you under anesthesia and we sedate you, you feel nothing. So depression brings you to the other side. So you can be depressed and you have a little bit of arthritis. With the depression, that arthritis get magnified. So that's a very important point. Yes.
Saying. Okay, let's just get down
sciatica.
and dirty to sciatica.
All right. So sciatica, I think is a general term, easy way for patients to understand, but pretty much you can call it lumbar radiculopathy. You can call it lumbar radicular pain. So pretty much the problem is at the level of the nerve, okay, in the lower back. There is irritation, inflammation of the nerve there. What is causing the inflammation most of the time is caused by a herniated disc. Okay, sometimes can be also depending on the age group. Usually from 40 to 60, usually it's a herniated disc. Older than 60 is more related to the arthritis causing occupying some of the space where the nerve travels, so that pinched the nerve.
Dr. Marrero, my mother, many, many years ago, my mother has passed away now a long time ago, but she had something called lumbago. What was that?
Lumbago is a general term to describe back pain. Okay, low back pain. It can be coming. But sometimes low back pain is not straightforward. Meaning it's not just one thing causing the pain. The pain generator can be more than one thing. So lumbago is just a general term to cover all the possible pain generator. But it can be pain coming from the small joints in the lower back, from the disc, muscle. So it's a general term.
We're finding so many people now doing exercise.
Yes.
And they're probably doing incorrect exercise, right? And they're coming to you and say, I've been working in the gym and now look what happened.
Sure. Every time I see a patient, I always review things that they have to avoid to injure their back. That is key, prevention. So, for example, I tell the patients, if you're going to pick up something, you squat, you don't bend, okay? Extremely important. Also, I tell patients, when you're sitting, try to sit up straight. Don't avoid sitting leaning forward, okay? Why? Because that increases the intradiscal pressure, the pressure in the disc, and that can, lead to herniation. So those kind of things, heavy lifting, okay? If you're going to carry something, you want to have it closer to your body, when you're carrying something. Your dog, for example.
Right, thank you.
But yeah, so, and then I guess some patients, they ask, all right, who is at risk to develop herniated disc, sciatica, and, this type of condition? So risk factors, genetic. So unfortunately, we cannot control that, but there are some risk factors that we can control, like smoking, okay?
That's right.
Obesity, we can control that. It seems that it's more common in male than female, okay? Another risk factor is doing a heavy manual labor, okay? But
a lot of times people will be lying in bed, everything's fine, and they get out of bed and they have what you call sciatica. Oh, my whole side of my leg So what's that caused by?
Actually, that is the most common. The patient the next day, they wake up and having the pain. But then when you go back and ask them, so what you were doing the day before or a few days before,
Having
and
sex? No, I'm kidding.
Okay.
I have to do that. Sorry, we have to do that. You don't know us. Sorry.
So and the thing is that sometimes the pain, the pain, right? We haven't described the typical sciatica, but sometimes the pain starts with just back pain, and then it progresses with pain spreading down to the leg. And that is the sciatica term is to describe that pain that goes from the back down to the leg.
Do we use heat or do we use cold? Let's say we wake up in the morning before we can come to your office,
right?
Because we can't hardly walk.
Right.
We what should we put? Get in a hot bathtub with Epsom salts? What should we do?
Right. So that is. Oh, I always get that question.
Okay.
Cold heat. Usually, I recommend cold for the acute episode. If it's something recent. But then, as time pass, it can be either cold or heat, depending on whatever it works for you. But in terms of treatment, since we started with kind of to talk about treatment, so we in terms of treatment, we want to treat the problem, which is inflammation, right? So we can start as simple as starting ibuprofen or naproxen. Okay, I tell the patient to take the anti-inflammatory medication every day at least for 5-7 days. Why? Because if you take it one day, then the next day you don't take it, it's not gonna give you that good anti-inflammatory effect. Okay, we can add some muscle relaxant, sometimes help, depending on the severity of the pain. Okay, sometimes the pain is really bad that the patient cannot get out of bed. Then sometimes we add an opioid or a narcotic, a short acting pain medication, strong pain medication for a short period, just to try to
get you over the acute episode.
Right, that severe episode.
So doctor, I'm going to go back to Dr. Mencia, please, for a moment, because and by the way, I think I ought to at this time just tell who you're listening to. I'm Anita Finley. You're listening to the Boomer Time Show, but this is the Wonderful World of Wellness from 7 to 7:30 every Saturday morning, and of course, it's our favorite doctor in the whole world, and that's Dr. Andy Mencia. He is in Fort Lauderdale, of course, with his office on Commercial, and also now they have the AGI Medical and Dental Centers over there in Boynton Beach. So let me give you a phone number since they're open on Saturdays. The phone number is 954-489-1345. That's 954-489-1345. Home visits, of course, are available for homebound patients. But we have a very special guest that Dr. Mencia brought today, Gabriel Marrero. That's Marrero, and he's a diplomate of the American Academy of Pain Medicine. And so I'm sure that almost everyone has pain at one time in their life, Dr. Mencia, and you get a lot of patients who come in there, and you ask them how they're feeling. And what do they usually say? Oh, I have a pain in my back, or oh, I have a pain in my head, or something. And you have to figure out if it's real or not.
Exactly. If we usually want to know how the pain came to be, how long they have that pain, and before we even send the patient to Dr. Marrero, what we do the triage on that patient. If the patient, let's say, develop an acute sciatica, and the patient is taking a blood thinner, before we even send the patient to Dr. Marrero, we want to check the level of the blood thinner to make sure that the patient is not too, the blood is not too thin. And
why
then,
would that?
Well, if let's say Dr. Marrero is going to put a needle to put some local treatment in the area, we don't want to have a complication of a hematoma, an internal bleed. So we work in conjunction with each other, just like we do with dental department when patient come for an extraction. We do our part of triaging the patient, making sure that before the patient go for any of this procedure, if Dr. Marrero decide that he want to do something more invasive to help the patient out, like we have one patient, she play golf, and all her life she been playing golf, so she never want to stop that. So when we see the patient, if they are taking a blood thinner, we either stop it for a few days, we might give some vitamin K to bring the level down and counteract the blood thinner for a moment so that Dr. Marrero then can do his procedure and move on. But I think, one question that I would ask Dr. Marrero that a lot of people don't know what to do. Dr. Marrero, sometimes people say, I developed this, I woke up, like you were saying, with this sudden sciatica going down my right leg. And what do I do? Do I go to a chiropractor? Do I do nothing? Do I go and see Dr. Marrero? What is the right thing to do first? Because sometimes I see patients that they go to the wrong doctor and they might get even worse than where they are. So why don't we educate the patient a little bit on what's the right thing to do? Who's the right person to see?
Right.
When
Most of the patients they recover within 6-8 weeks, meaning that the pain goes away. Okay. During that, during this acute episode, again, we wanna have an anti-inflammatory medication on board. Okay. We can add physical therapy, okay, depending on the severity of the pain, or pretty much manual physical manipulation, meaning physical therapy. Chiropractors sometimes help in this acute episode. But of course, the question is, and as you said, the triage. If we are dealing with just pain, or we are dealing with significant, because we're talking about nerve, a significant neurological significant involvement of the nerve, meaning that if the patient has significant weakness, patient has dysfunction in their bladder and bowel function, those things you need to make sure, when you're seeing the patient for the first time with this sciatica.
So wait a minute, you're seeing the person the first time, and usually they say, tell me what your pain is from a scale of 1 to 10. How is someone supposed to know what the scale, how that feels?
Right. Every patient, they're going to have their own scale, but it helps you to have a start point and then see how pain progresses. Meaning, your pain level might be a 7, and for me, we're talking about the same pain, might be a 5.
Right.
But we use that mainly to see how the pain progresses.
So if someone says,
so in 2 weeks,
it's a 9,
in 1 week,
you're in trouble, right? But they say 2,
right. Right.
Well,
and also to see how it progresses.
7, let's say, and we give you medication, we want to see how this is progressing. So, okay, so if it went from a 9, it came down to a 2, then we are doing great. And if it's a 9 and it's still a 9, we did nothing. So it's sort of to follow up the treatment.
So it just gives you an idea, so
exactly,
they know.
Right, give us an idea.
Like, how do I know if mine's a 3 and yours is an 8?
So then, in that case, that was very interesting what you said, because if it's a severe damage to the nerve, then you might consider getting a specialist.
Because it's rare. It's rare to for a patient to present with sciatica, with radicular pain, and have significant weakness or loss of bladder bowel function. But you can see those cases. It's rare.
Mm-hmm.
Okay, and that is why you have to check on that, because that is you have to order an MRI right away, and probably you need to consult the spine surgeon. Okay, why? Because if you don't address that, the patient can end up with some deficit,
permanent damage.
Yes,
but
permanent damage to the nerve.
So are these MRIs? When do you take the X-ray to see if someone?
Right.
What's the first thing?
So this is the thing. As I told you, most of the patients within 6 to 8 weeks, they should, the pain should subside, get better. However, again, every patient is different, and you want to see how the pain is progressing. How are the limitation of the patient? Because if the pain is limiting the patient, you want to, try to get the patient back to normal. So in terms of studies, the best study when we're talking about sciatica, the best study to do is MRI. Okay, why? Because we can see very well the disc, we can see the canal, we can see the nerve. Okay, X-ray is not going to help you much in that sense. Some patients, they cannot have an MRI, and the reason is because probably they have a pacemaker or a metallic device that is not compatible with MRI. So those patients, they go for a CT scan, okay, of the lumbar spine. And it also helps to see the spinal canal and the disc, and it gives us good information. And it's just to try to find out where is the problem, okay? And from there, we can also determine if patients are not getting better with just conservative treatment, meaning anti-inflammatory medication, physical therapy, then we can move on with an epidural injection.
Now, when you say anti-inflammatory, you're talking about like Tylenol.
I'm talking about Aleve, naproxen, ibuprofen, meloxicam, Celebrex, those medications that are in that family.
Now, you want to tell the doctor then, in that case, if you are taking that at home over the counter, when you come in, let's say with a level of 8, and they say, I'm taking Aleve, and I take 4 Aleve at the time, and the pain's still an 8. So it sort of give you an idea of how bad the pain is.
So what I tell them, as I mentioned earlier, so you want to have that anti-inflammatory medication on board, okay? And even sometimes we give medrol dose pack. However, there is controversial study about medrol dose pack, which is steroid, okay, by mouth, short period.
Prescribed steroid.
However, we still see patients that, not all of them, but some patients, they get, they get better with the steroid. But yeah, so if this is not enough, then you need to add a pain medication, okay? A short-acting pain medication, and it's going to be for a short period. It's just to help to try to keep the patient, functioning.
I want to give some phone numbers. Now, if you want to call Dr. Marrero directly, is that
they can call him directly, or they can call my office.
Yeah, well, I think
we usually, when they call the office, we direct them to the other office. Okay. So either way.
Let's just do that. Let's give them the one phone number. So it's 954-489-1345, and that is the Fort Lauderdale office on Commercial Boulevard. They do have another office, of course, in Boynton Beach, which is on Hagen Ranch Road. And I don't know, how's your dental department starting to work? You're doing
great.
Such gorgeous stuff with that. We're really happy. But Marrero is spelled Marrero, right? And Dr. Marrero, where are you from?
I'm from Puerto Rico.
Puerto Rico.
Rico.
I had to. Okay, you want me to give his phone number?
His phone number.
Okay. Phone number is 954.
That's his direct office.
Right, 493-5048. That's 954-493-5048, and he's over there on Northeast 47th Street. I want to tell you about this before we run out of time. I went to this convalescent home, and I walked in, and there were a lot, people sitting there who are living there. And one woman came up to me, an older woman sitting in her chair, just kind of bent over in her wheelchair. She said, I could tell she had an accent. And I said, where are you from? She said, Puerto Rico, she said. And I was talking on my book, Live to Be 100 Plus. She said, I can tell you're going to be 100 plus and more. You have something. Yes, I'm Puerto Rican, and I can tell you that. It was a wonderful thing. So I really loved her, and I loved Puerto Rico yesterday.
Thank you.
So this is great, Dr. Mencia. You always have people with such wonderful specialties. And so when people come to you, and you're very careful, and I know that, you know who to send them to. And then the difference is you watch over them. Just because they go to Dr. Marrero, they're not out of your barn.
Right. And same thing with the dental, with all the specialists, because the beauty is all of us working as a team for the well-being of the patient.
Yeah, and so your pain, we haven't, and we don't have any time left, but maybe another time we can go back. It's sometimes people have pain in their head. It's not just in their back, and so is that something you would deal with also? Neurological problems? If
we send the patients when we need
to a neurologist.
We have a neurologist at the center, so we work together with the neurologist and Dr.
Because
Marrero,
we were just talking about pain medicine for your
body.
And also there is a psychological specialty for pain.
Right. Yeah, I'm sure there is.
But people can have no migraine. They can have what we call cephalalgia. that sometimes we send the patient to pain management.
Oh, yeah.
And,
Cervicogenic pain.
Yeah.
And we can talk about another, pain. People go to acupuncture. A lot of things happen, right? Well, Dr. Mencia, we did it again.
We did it again.
And we brought a very nice young man here,
Thank you so much.
Dr. Marrero.
Thank you for the opportunity.
Oh, yeah, Dr. Marrero. And we hope that you have a great weekend, and we're going to be right back. We have another guest waiting, and thank you.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.